Thank you in advance for this opportunity, and I will appeal to my synthesis capacity to talk to you about reaching out people experiencing incarceration. In the next 15 minutes, the United Nations Office on Drugs and Crime estimates close to 11 million prisoners worldwide. As you see in this board, half of them are distributed only for the top 5 countries, with the largest number of prisoners. As of July 2021, the United States had the highest number of incarcerated individuals worldwide, with almost 2.1 million people in prison. The US was followed by China, Brazil, India, and the Russian Federation. The United States has an incredibly high number of incarcerated individuals. Within the numbers that we follow by the Organization for Economic Cooperation and Development countries, the United States had the highest rate of incarceration worldwide, with 639 prisoners per 100,000 residents. In the vast majority of countries, including the Southern European countries, the prisons are overpopulated, exceeding the official capacity in many institutions, from 120% to 250% in some of them. The proportion of people in prison has grown by around 20% since the year of 2000. This is greater than the population growth. Over this time, while the proportion of male prisoners has grown by 18%, the proportion of women in prison has increased by 50%. 1 in 5 people, male and female, in prison are living with HIV. It's estimated that around 3.8% of the global prison population is living with HIV. Prevalence differs greatly between regions, with the proportion of prisoners living with HIV greater than 10% in 20 low and middle income countries. The UNAIDS estimates that people in prison are on average 5 times more likely to be living with HIV compared with the adults who are not incarcerated. The World Health Organization, meanwhile, estimates the difference higher, suggesting that prisoners are 50 times more likely to be HIV positive than those who are not imprisoned. Here are some key points to people incarcerated living with HIV. Sharing needles for drug use, the unavailability of condoms, the rape and are persistent issues within prison environments and among prisoners. They will lead to increased HIV transmission. Injecting drug use, the use of contaminated injecting equipment when using drugs is one of the primary routes of HIV transmission in prisons. Tattooing is still a commonplace among prisoners. Those who perform the tattooing tend not to have new or sterilized tattooing equipment. Availability of condoms. Many countries provide condoms, but the access is still problematic. In some cases, they need to be prescribed by a medical doctor in the prison. Other prisons give one per day, and other ones don't give anything to the prisoners. Additionally, sexual activities are often forbidden in prisons, which the provision of condoms led to such behavior. We must stop barriers and facilitate the common access to condoms. The deficit of HIV programs of prevention will also increase the risk of HIV transmission among prisoners. And for prisoners living with HIV, adherence to antiretroviral treatment is often difficult and promotes spread of infection. There are some strategies to reach and reduce risks in this incarcerated population. First of all, facilitate the access and distribution of condoms. The needle and syringe programs provide to drug users with access to clean needles and syringes in order to reduce the frequency of injecting with contaminated equipment. The reduction of sharing needles by the prisoners will reduce the levels of HIV transmission. The opioid substitute programs, or the opioid substitution therapy, is another harm reduction approach that aims to reduce heroin by providing a substitute in the form of, for example, the methadone. Prison opioid substitution therapy programs can be effective in reducing injecting drugs and needle sharing. We need to invest in more HIV information, education, and communication. Specialized HIV healthcare givers and workers are needed to stop the spread of HIV in prisons. In the last 2 years, or 1.5 years, almost 2 years, we have seen a spread of a deadly virus into the world, the COVID-19. And the virus has not stopped at the prison gates too. So it was a new challenge, a very big challenge for the community living in incarceration. And when we talk about this, we know that the preparedness and responses in prisons were not very fast. But during this time, daily testing programs were implemented with antigen tests. In some facilities, many prisoners reduce activities in prison. And the people that rule the prisons, they reduce those activities to only that are necessary for running prisons, such as cooking and waste management. New prison admissions, as well as transfers between institutions, contributed also to increase the risk of transmission. Some prisoners benefited from early release, and the number of prisoners decreased in some institutions. Some options as the video call system, in some cases, in some prisons, was deployed for prisoners contact their family, because they are forbidden to contact the family face-to-face. Testing programs to incarcerated people and visitors before entering the visiting room, when the opening of the facilities were made to the families, some testing programs were implemented. But there were very much more difficulties and consequences. Some prisoners in some facilities refused to be vaccinated. Selfharm events in 2020 is one of the highest ever recorded worldwide. Issues of mental health greatly increased due mainly to the suspension of visits. 23 hours a day in their cells, long stay at cells, a very few time to exercise in the yard, limited in many cases only to 30 minutes. Initially, some prisoners experience self-isolation forced, not allowed to leave the cells. The shower and the exercise outside was limited too. And at last, the lack of food in quantity and quality were not an option. It was truly happen. So this kind of challenge led us to think that preventing and controlling HIV in prisons, it's a path that is still very long. These incarcerated populations are many times neglected by many countries, some of them Western countries, and some nationals' health systems don't care about it. Many of these individuals will be integrated soon in the outside world, in the society, and we must care about these people, we must care these people. Avoiding these people will be a health problem, and an HIV small group population that it will be always neglected, and we must do something to decrease the highest levels of HIV in this kind of population. Thank you so much, and I'm pleased to present this to you. Thank you.